You are on Gaywaves. My name's Mark Haddon, and today I'm interviewing the friendly bear. It's Dr. George Forgan Smith. Hello, George. How are you going?
I'm really good, thanks. Thanks for having me.
Look, much. It's very, very much a pleasure. So we're talking today about, primarily about monkeypox, because it seems to have hit Australia, not in a big way yet, not like overseas.
Mm,
And I suppose it's like, what do we need to know? All that sort of stuff. So let's start about,
yeah.
yeah, let's start with what it is.
Monkeypox is a viral illness. Its origin is smallpox. Actually, it's come from Africa. Somewhere along the line, it's crossed into travelers who visited Africa, and they brought it, I suspect, into Europe because we saw the first cases of Europe. There were some cases in Portugal, there were some cases in Spain, and interestingly, there were some cases in a kink event that was happening in Belgium. In Belgium, and gay men are a unique group of people in that we travel. We have the money to travel, which means that we come together in groups because of various different things. We often meet in small, discrete places. And by discrete, I don't mean like, oh, hush, hush. I mean discrete as in there's only one or two places that you can go to, right?
Mm.
And so you have a group of people who all come together and then separate off to their respective homes. And unfortunately, if there's an outbreak of something, whether it be hepatitis A, whether it be meningococcal, or whether it be monkeypox, unfortunately, travel is a brilliant way to pass things around. So that's pretty much the way that monkeypox has sort of gotten out, I suspect.
Yeah.
I'm happy to be corrected, but that seems to be the main pathway at the moment. For example, in Australia, probably one of the biggest risk factors we are seeing for monkeypox is recent international travel, particularly to America, particularly to Europe. And oh, what's just happened recently? A huge amount of pride events. So
Yeah.
you're out, it's summer, you're not wearing much clothes. If monkeypox if you've got lesions on the skin to skin contact, brilliant way of passing it. And, we're a social group of people. We like to give hugs, we like to put our arms around people. And unfortunately, that's a bloody brilliant way of transmitting the virus. So, yeah, it's a
So
bugger.
yeah, so we're the perfect vector for carrying the disease, unfortunately, because we do the big
Yeah.
events like IML and different type of get-togethers. So yeah, what should someone be looking for if they think they've got monkeypox? What's the symptoms that happens?
Well, the standard symptoms, if we're going to get out the textbook, what we say is that people have a prodrome. So they have a flu like illness. They feel awful, um, fevers all the way up to 38 degrees, muscle aches and pains, feel awful. Then the next stage, you can get a rash that seems to be around the edges of the body. So we're looking at the head, the hands, the feet. Um, and then from there, you can get pox like lesions. They look a little bit like chickenpox, actually. They come out in crops across the body, and yeah, it's an interesting one. But the data from Australia, at least in the WHO webinars I'm hearing, is that not everybody's getting those symptoms. Only about 50% of people are getting the prodrome, the fevers, and all of that sort of stuff. But
Mm.
what's interesting is that we are really seeing a lot of lesions on penises, a lot of lesions on bums. I was talking with my GP today, and he was saying that yes, we've had a couple of cases where people have had monkeypox lesions in the urethra, excruciatingly painful, up the
Mm.
bum, excruciatingly painful, and this is because of the skin to skin contact that can happen with anal sex. So
Yeah, I've
you can get them inside the mouth.
mm.
Yeah,
I've actually
it's
heard some real horror stories with, especially in around the bum. Like even when you go to wipe, it's excruciatingly painful.
yeah,
And
and it
yeah.
It just sounds horrible. Like I remember when I had chickenpox, I was just glad to have a week off school. It didn't seem that
Mm,
big a deal, but I wouldn't wish monkeypox on anybody. It just sounds absolutely horrible. Um, Now, on the subject of absolutely horrible, you've
mm,
got these vile people like that green woman in America who's basically saying, "Oh, it's a gay disease and blah 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 blah." And I think any sexual contact is a transmission risk, but we have to be aware that skin to skin contact is not necessarily sexual.
yep.
Picking up a baby is not sexual. Giving your grandmother a hug is not sexual. But if you have monkeypox and you give your grandmother a hug, whoa, that would be it could be potentially very bad for an
Mm,
elderly person, for a young person, for somebody with a severe immunocompromise. These are the groups of people that we want to say, let's just not allow it to happen. In Australia, we are in a really wonderfully unique position because we have extremely low numbers at the moment. We're not like London, we're not like New York, where we're seeing thousands of cases. We are under 100 cases here in Australia at the moment. I think under 50 in Sydney. We're definitely under
mm,
50 in Melbourne.
mm,
And so we have this very good opportunity. And today, was a magical day here in Melbourne. I'm not sure what the first day was in New South Wales, but
mm.
today the vaccine came out and it's bloody brilliant because this means we have an opportunity to stop the outbreak well before it can turn into something really big. If we can vaccinate as many people as we can, we could break the back and contain it and stop it from spreading. And I think
Yeah,
that's so, so important.
exactly. Now, I do want to talk about the vaccine, but just before we do that, um,
Sure.
what should someone be looking for if they, I think they have it? I mean, is it the fever? Is it the rash? What would be the thing that would give it away that it looks like it's monkeypox?
The cases that I have seen are interesting. One patient came and he was in America and he had a sore on his penis,
Mm,
right? And I saw the sore and it looked like syphilis. He went to a
right.
doctor in America and they said, "Yeah, it looks like syphilis. We're going to treat it like syphilis."
Mm,
But a few days later, he felt awful. He got a really bad flu-like illness and this lymph node in the groin just went up. It really went big. And then when he saw me, there was another sore on his tummy. And that was
right.
it, right?
Yeah.
All of the doctors that I've spoken to have seen similar cases. They're basically saying, look, it's one or two spots. Um, so it's actually a bit of a diagnostic challenge because there's lots of things that can cause spots on skins. But at the
Mm,
moment, I think that if you're in a risk group, if you've traveled internationally, if you've had some good episodes of skin to skin contact, in particular in the settings of like a sex on premise venue or an event that was highly sexualized, or even events where, say, for example, Folsom or Dore Alley, which just happened in America,
mm,
where you could be dancing skin to skin. Like you don't have to have your pants off. You could just be having a bit of a boogie. And if between 3 to 20, 21, maybe 28 days later, you're noticing these little chicken pox like rash, little blisters that then pop, they might have pus in them, they might have, they look like little crusted over lesions. If you're noticing that, then it's really important that you get them swabbed so we can say, is this monkeypox or not?
mm,
Herpes, right? I've seen somebody who was worried about monkeypox. I did a swab, and thankfully,
mm.
well,
Yeah.
thankful, not thankful, it was herpes, right? But herpes is kind of different in that it's a small cluster of spots that are only going to ever be in one spot.
Yeah.
You're not going to get herpes all over the body, whereas monkeypox, it can be all over the body. But particularly if it's around the arse, particularly if it's around the genitals, and if it's
Mm,
painful, you please go and see your doctor, get a swab done so we can say what the heck is going on.
yeah.
Yeah.
And look, I mean, I suppose, I mean, there are some big events coming up. I know in Sydney, there's some big events. So, should people be thinking about going and getting a vaccine?
Bloody oath. It's there. They're giving it away. It's free.
Ah, it's
Why wouldn't
free.
you? Like,
Okay. Yeah.
it's absolutely free. It's provided by the government. And I don't know a single doctor who's not bulk billing an appointment to give out a vaccine. Like, this
Yeah.
is vital. I jabbed 20 people today, and they all walked away with their arms swinging and a band-aid.
Yep.
They didn't have to pay a single cent to get vaccinated, and certainly I know in Sydney, all of the high caseload cases. When I say high caseload, what I actually mean is gay clinics.
Mm.
Like here in Melbourne, we're rolling it out in the gay clinics, and I believe it's the same in Sydney.
Yep.
I'm not familiar with all of the places that are
Mm.
listing it in cities, but the big names, you know them. They're definitely vaccinating people. Yeah, it's free. Now, look, a lot of people are worried. So, that, what if I have immunocompromised? What if I'm HIV?
Mm.
Positive, sorry, HIV positive. Um, it's safe. This is a live vaccine, but it's been attenuated, so it cannot replicate. It can't give you smallpox. It cannot give you monkeypox, right?
Mm.
It's a very weakened form of the virus, but what it will do is it will help your body create an immune response.
Mm.
The best time to get vaccinated is before you have monkeypox. So get it done now,
Yeah.
right? The numbers are low. Now's your window of opportunity.
To get it done.
If you've had a close exposure to monkeypox, get the vaccine within 4 days, and that will help prevent an infection.
Mm.
If you've had a close encounter, but it's been more than 4 days, but less than 14, you could still get monkeypox, but the case will be very, very bad language. It'll be less severe.
Right.
It'll be a milder case. So that's big tick, tick, tick in my books as well.
Yeah. Because
But as I'm sort of,
I've heard there's two
okay,
different vaccines available. One is
no,
no, it's just one.
but this was before we have access to the good stuff, right?
Yeah.
There
All
there
right.
are two vaccines. There's
Right.
the ACAM 2000,
Yep.
which is the old-fashioned one that we gave to kids. I got one as a kid at 18 months.
Yeah.
If you're over the age of say 45,
Yep.
like we stopped vaccinating smallpox in Australia in the 70s.
Mm.
But if you've got a scar on your shoulder, that's probably a smallpox vaccine scar, right? They
Mm.
got a needle and they jabbed it in, and it's like a scarification process. It's not a single injection, it's 15 little jabs.
Mm.
It's horrible, absolutely horrible, and I wouldn't recommend it. And we know that it may not be as good for protection, because once you have the sore on your arm, you have to nurse that. You've got to keep it covered. If somebody touches it, they can get smallpox from it. So it's really bad. In Australia, we are extremely fortunate. We have been able to get supplies of a third generation smallpox vaccine called Genios.
Yeah.
And this is much, much easier. It's a simple injection. It's given into your arm. Ideally, it's given with 28 days in between the shots. That said, worldwide, sort of like where all of the health people are coming together and say, look, we are better to vaccinate as many people with one shot than to try and get a small group of people with two shots, when really the supply is limited. I'm sure
Mm.
that the people who are making the drug are really ramping it up. But even here in Melbourne, we only got, I think 2,800 doses initially,
Yep.
and we're getting more in September. But that initial rollout is for people who are at the highest of risk.
Yeah.
And I believe it's similar in New South Wales,
Wales. Yeah.
but here in Victoria, we're looking for people who have had a close exposure, people who are working in laboratories with the actual virus, or men who have sex with men, and that can be a cis man or a trans man.
Mm.
But you've got to be sexually active. So you either
Yeah.
go to a sauna, you've had an STI in the past 12 months,
Hmm.
um, or you're traveling to Europe or to America very soon,
Yeah.
because they're the high risk places to go.
Yeah.
Also, there are some other windows of opportunity. If you're homeless, if you have significant substance use, or if you have a psychiatric illness that could lead to bad decision making.
Yeah.
And then finally, sex workers, people who are working with men who have sex with men.
Hmm.
These are all the criteria for getting the vaccine here in Victoria. I think in New South Wales, we're looking at a similar kind of picture, but I'm not 100% sure.
Yeah. Some of the research I've done seems to indicate you get the vaccine and then over time your immunity actually grows. Is that what you've encountered, or is it just
Absolutely. So,
yeah?
like with any vaccine, you are
No.
not immune the minute you get the shot.
Yeah.
What happens is that the injection goes into your body.
Mm,
It gets picked up by the lymph nodes that then start making antibodies. So it takes a little while. So for the first injection, when you've had about 28 days after injection, I think it's around about 60, 70% protection.
mm,
14 days after your second injection, if you're HIV negative, we're looking at about a 98% protective value. And if you're HIV positive, we're looking at about a 96% protective value. People with impaired immune systems, and that's not just HIV, we're talking about
mm.
people who are on chronic steroids for various inflammatory diseases, people who are on chemotherapy, yada, yada, yada. It's safe for you. However, it's probably going to be more important that you get the second shot because you may not have as strong a response.
Right.
So, talk with your doctor to say, look, should I be prioritized for the second shot to make sure that I've got the best protection I can get? But yeah, the immunity will build over time. So you can't just have the shot and that night hit the sauna and
Mm,
take up residence in the sling and expect to be protected. It's
yeah.
give it a month.
Yeah.
Be patient. Be
Yeah.
patient.
Maybe just
Set up a guest list.
yeah, do stuff over the internet rather than
Knit. Make
skin to
yourself a
skin.
nice harness.
Well,
Get
you're
that outfit looking schmick.
well, you're quite famous for your knitting, aren't you? You
Oh well, the word has gotten around that
right.
I'm a crafty sort. Yeah. Well.
Exactly. I believe you've knitted things like bollard covers and everything in your time.
Oh, it's bonkers the stuff that I've knitted.
Yeah.
I've knitted vaginas. I've knitted.
Oh,
Yeah, but then you do all the boring stuff like
yeah.
that. But nobody wants to get a vagina for Christmas. Well,
Well,
I stand
some
corrected.
people
Plenty of
would.
people want to get a vagina for Christmas, but maybe not a knitted one.
Yes.
But hats, like I'm getting ready for Christmas. I'm already making hats like there's no tomorrow. But
Yeah.
yeah,
So, I
we're
mean,
not here
but
to talk about my hats.
exactly no, but look, monkeypox. Obviously, it's here.
Yep.
So the recommendation is definitely if you're sexually active, if you're out in the community, go and get a vaccination. Go book in with your local
Yeah,
GP and go and get
get in there.
vaccinated.
Now, let's just be really freaking
Mm.
clear about this, right?
Yes.
I just set up a clinic, so I know what it's like.
Yep.
My poor front desk staff are being slammed because
Mm.
we've only got here in Melbourne, we've only got 5 clinics who are offering the vaccine. I run a tiny clinic,
Yeah.
and there is a little sense of frustration in that you may not be able to get it straight away.
Yeah.
So please be nice. Be
Yep.
nice. Be pleasant to your doctor because we want you to get vaccinated, right?
Mm.
I'm not doing a 16-hour days just for fun, right?
Mm.
It's because I want the community to get vaccinated. So please be patient, but be present and keep your ears out. Also, talk with your doctor about it. Like I went and saw my GP today, and
Mm.
because like I wasn't booked into the clinic because I am going to Berlin for Folsom. I was
Mm.
fortunate that he did have a spare that I was able to get.
Yeah.
So sometimes it's good to talk with your doctor if you're particularly worried or concerned,
Yep.
um, because we can understand that there's an urgency there. The other thing is that today I actually had to tell 2 people that I couldn't give them the vaccine, and they weren't exactly thrilled.
Yeah.
But it was a heterosexual woman and her husband, and she's saying to me, "Well, the government website says that it's open to everybody." And I said, "Well, the government website doesn't say that."
Mm.
Um,
No, it doesn't.
I'm not sure whose government's website you're reading, but it's certainly not the Victorian one. And I kind of make fun of it. I'm just like, when I was talking to her husband, I said, "Are you planning on having sex with other men while you're over there? Will you be going to sex on premise venues?" And they're like, "Oh no!" And I said, "Well, then I don't think you need to worry about it because
Mm.
it's at the moment."
Mm.
Here's the thing, right? At the moment,
Moment.
it's
Mm.
kind of contained in a group of people. But if you're going to take up residence at laboratory in Berlin or something like that, then yeah,
Yeah.
tick tick tick, get into it. Now I got to
Yeah.
say that like people have been proactive. AIDS 2022 just
Mm.
happened in Montreal, and God, like there are some bad things to be said about Canada after that event. There were
Right.
speakers who couldn't get visas to get in, but if
Wow.
they did one thing right, they set up monkeypox clinics everywhere. You
Mm.
could not turn a corner without getting jabbed with a needle. So
Yeah.
that was a really good thing. They were super proactive. In America, they like in New York, they have to have a freaking lottery system to get a shot, which
Yeah.
is just crazy.
Yeah.
But this is the problem. It's supply and demand. And
Yeah.
what I can tell you today from the people I've been working those phones, I'm like I don't know, I feel like I'm selling electric plans or something, but
Mm.
actually people want me to
Yeah.
call them. So when I'm talking to them, they're so grateful because they are genuinely worried. And
Mm.
this is such a nice change. When if I go into the CBD on a Saturday, normally there's people rioting about lockdowns and vaccinations. And I'm like, I think
Mhm.
you're a little bit late to the game on that one. But
Yeah.
God bless the gays. We're
Yeah.
enthusiastic. We're getting in there, and we're we're getting it done. And I'm really very chuffed about that.
So do you think, seeing it is mainly within the LGBTI community or the gay community at the moment, that it, like, we've headed it off, it's not going to be the next COVID, it's going to be more maintained, or do you
I
think it
hope so.
has the potential? Yeah.
I'm hopeful.
Yeah.
I'm hopeful. We are in such a wonderful opportunity. Like the thing that screwed us over with COVID was that it took so long to get the vaccine out.
Mm.
And then we really tripped over. We screwed it up with the AstraZeneca. That was a bad thing. That
Hmm.
AstraZeneca wasn't the best vaccine. It was an effective vaccine, but the publicity was terrible. Jynneos is safe. I can tell you that it's safe
Safe.
as
Yeah.
long as you're not allergic to a, a few antibiotics. As long as you're not anaphylactic to eggs, you're
Hmm.
fine. You can get the jab, and you're going to be totally cool. So we don't have that problem. We have supply and we have it early, and that makes a huge difference.
Mm. Do you, just talking about COVID, do you think people have got a bit complacent about COVID these days?
Yes,
Yeah.
I don't know what it's like in. Did you know?
Mm.
Fun fact: in Victoria, it's in the law says you have to wear a mask on public transport,
Mm. No one
and they
does.
don't enforce it.
Mm.
Nobody enforces it, and I'm really particularly worried because whilst I'm not immunocompromised, I need to do my job, and if I
Yeah.
get COVID, I'm screwed.
Mm.
So I'm actually wearing N95 masks, and this is what I'm actually telling to people now. That so I would encourage people at the moment is get back into wearing masks. Right, the more
Yep.
people that wear a mask, the safer we are. And if you're in environments where you cannot control the airflow, so public
Mm.
transport, inside a closed environment like a restaurant, um, or if you're immunocompromised in any way, I don't think you need to wear a mask outdoors. I think that's probably okay, unless you're really packed in, like, I don't know, Splendor in the Grass.
Hmm.
That had a massive COVID outbreak, or as they called it, Splendor flu.
Yeah.
Um, and most people didn't bother getting tested because they
Yeah.
either they knew what it was going to be or they just thought, oh, it's just a cough,
Yeah.
you know. Um, but what I would say is buy the best quality masks that you can buy.
Mm.
Cloth masks are okay, but they are only okay. Surgical masks, one step up. But if you're worried,
Mm.
get yourself a good quality N95 or a P2 mask. You can get it from Bunnings, you can get it from Coles. They're cheap now. They're
Yep.
plentiful now. They have to fit and they have to be tight. If they feel a little bit uncomfortable when you first put them on, that's probably a mask that's going to be much more protective than one that's flopping all over your face. And for the love of fucking God, I'm sorry about this, but I have to swear to emphasize this.
Mm.
Masks do not work if they're on your chin. Masks do not work if they're under your fucking nose.
Nose. Yep.
The highest population of COVID in the body is in the nose. For
Mm.
fuck's sake, cover it.
Mm.
Nose, mouth, and chin. All of those must be covered.
Yeah.
Um, there you go. That's my tambourine shake. Done.
We'll get you off the soapbox, but yeah, look, thank you very much for that, George. Look, and thank you for giving us some very important information for the LGBTI community.
Cool.
And
My pleasure.
welcome to Gaywaves, and hopefully we'll get you back at some point to talk about
I'd
something
love
else.
to.
Yeah,
Please,
would love to have you back.
look out for me.
Mm,
I know that Gay Waves is probably international, but if you have a Sydney following,
mhm.
look out for me. I'm going to be at the Kink Fest and teaching there. I'm going
Oh,
to be teaching
cool.
some safe kink. I'm going to be
Mhm.
teaching safety in human pup play.
Yep.
I'm really looking forward to it. So if you're at Kink Fest and you want to say hi, come up,
Come
say good day.
along. Yeah, exactly. We'll definitely.
Yeah.
We'll have to say hi when we see you at Kingfest. That's brilliant. All right.
Yay! I'd love it.
All right. Thank you very much, George, and thank you for all your advice. Thank you.
My absolute pleasure. You
Cheers.
have a wonderful day. Stay
You
safe.
too. Thanks, mate.